In our webinar tonight,
The broadcast is now starting. All attendees are in listen-only mode.
good evening. Thank you for joining WomenHeart, the National Coalition for Women with Heart Disease, for our webinar this evening, African American Women and Heart Disease, What You Need to Know. I'm Emily Swartz, Senior Associate for Public and Patient Programs. Today you will hear from Lisa Clow, our Vice President of Public and Patient Programs, with opening remarks. And presenting tonight's webinar will be Dr. Jennifer Mieres, Professor of Cardiology and Chief Diversity and Inclusion Officer at North Shore-LIJ, and also a WomenHeart Scientific Advisory Council member. Her presentation will be followed by a live Q&A session where you will have the opportunity to ask her all the questions you want about African American women and heart disease. I will provide the instructions for the live Q&A when we get to that portion of the webinar. So without further ado, I'm going to turn it over to Lisa Clow for her opening remarks.
Good evening, and thank you for joining WomenHeart for this very special presentation. As some of you may know, we do this presentation every February during Black History Month, and I would like to take just a minute to share some recent statistics with you about African American women and heart disease that really kind of drive home the point about why we feel this topic is so important, and we want to reach out to women and let them know. Currently, 48% of African American women have some form of heart disease. And cardiovascular disease is the leading cause of death for African American women, as it is for all women in the United States. 47% of African American women have high blood pressure, and African American women are more impacted by stroke than any other racial group within the American population. In addition, 81.9% of African American women are overweight or obese, and 58% do not meet the 2008 Federal Physical Activity Guidelines. The good news here, though, is that 80% of heart disease is preventable, and that goes for all of us. So we're excited to present this program, share some new information with you, and of course, very pleased to have with us tonight presenting, as Emily mentioned, Dr. Jennifer Mieres from our Scientific Advisory Council. Be sure to stay with us for the entire webinar, as Dr. Mieres will be available to answer your questions during our live Q&A, and thank you again for participating this evening. Dr. Mieres, over to you.
Hello, good evening. Thank you, Lisa, for that kind introduction. Thank you, Emily, and thank all the attendees for joining us this evening. As mentioned, I'm Dr. Jennifer Marez, cardiologist at North Shore-LIJ Health System, and I have the distinction of being the first Chief Diversity and Inclusion Officer of the North Shore-LIJ Health System, with the focus of really eliminating health disparities. And pleased and honored to be a member of the WomenHeart Scientific Advisory Council since its inception. What I'd like to do today is spend some time with you discussing the journey of cardiovascular disease in women. We'll talk a little bit about what is cardiovascular disease, and then focus on cardiovascular disease in African American women. We'll talk about risk factors, and then end with a few strategies to prevent and control heart disease. Because as Lisa mentioned, 80% of heart disease is definitely preventable. When you think of cardiovascular disease, you would see that we have made significant progress in the past decade as we have focused as a nation with all of our initiatives and awareness programs on the gender-specific aspects of cardiovascular disease. And so over the past decade, we've seen about a probably 25% decline in the number of women dying from cardiovascular disease. So as we move to take a look at the scope of the problem, we see that in spite of all of our advances in technology, in spite of our advances in understanding the gender-specific aspects of heart disease, the cardiovascular disease still remains the #1 killer of women in the United States, and also becoming the #1 killer of women globally. Facts about cardiovascular disease includes that it causes 1 in 3 women's deaths each year, killing approximately 1 woman every minute. And as mentioned by Lisa, we have an estimated 43 million women in the United States are affected by some form of cardiovascular disease. And you look at the United States globally, 90% of women have at least one or more risk factors for developing heart disease. And so it's important that we turn our attention to prevention strategies to decrease the number of women dying from heart disease. As we take a look at the state of heart health in 2015, we see that yes, we have made progress. Yes, the death rate has decreased for women dying in the United States from heart disease, as mentioned, by about as much as 25% or a little bit more. But what is surprising and startling is that gender and racial disparities still exist. And at high risk, and the highest risk among women are African American women, followed by South Asian men and women, and Latino women. In spite of our awareness efforts, and we've had several campaigns from WomenHeart, from the NHLBI, and from the American Heart Association, the Go Red for Women campaign, women are still less likely than men to be aware of their overall risk of heart disease because we still think it's not going to happen to us. The important thing again, 80% of heart disease can be prevented. Simple lifestyle changes are crucial in reducing our risk of dying from heart disease and developing heart disease.
Okay, everyone, we just got to our first poll question, and I am going to read you the poll question, and you are going to select an answer. So the first question is, what is your ethnic and or racial origin? I went ahead and launched the poll. So I'm just going to go ahead and close it once about 80% of people have answered. Okay, thanks very much, everyone. I'm going to close the poll. Okay, Dr. Mieres, back over to you.
Thank you, Emily. So as we look at the past decade or the past 15 years since we started our focused research on women and heart disease, we have learned that all women are at risk for cardiovascular disease across their lifespan. We have also learned that in spite of our awareness campaigns, still there are disparities, and still we need to increase our efforts so that all women know that they're at risk for heart disease. And you look here at the American Heart Association statistics and updates in looking at awareness trends. You can see that when we started in 1997, only 33% of Caucasian women, 15% of African American women, and 20% of Latino women recognized that they were at risk for heart disease. And heart disease was their biggest threat. As you look across the years, you can see that each couple of years that the poll was taken, you can see that by the time we got to 2009, 60% of Caucasian women recognized they were at risk for heart disease, compared to 43% of African American and 44% of Latino women. We had a spike in 2006, not sure why, but 3 years later, the numbers had decreased. And when you look at the latest statistics available, the 2012 poll showed, again, startlingly, that we have a lot of work to do in eliminating the disparities in awareness. In 2012, as you see there, 65% of Caucasian women recognized that heart disease was their biggest threat, compared to 36% of African American women and 34% of Latino women. So let us pause for a minute and spend let's take the next few minutes to sort of discuss what is a definition of cardiovascular disease. When we hear the term cardiovascular disease, it pretty much means atherosclerosis, or buildup of plaque and fatty material deposited in the lining of the vessels that supply the heart. The same thing can happen in the brain. So it's a disease caused by atherosclerosis, where the lining of the arteries are damaged, leading to the buildup of fatty material, leading to a decrease in blood flow. And what are some of the diseases that constitute cardiovascular disease? Next slide, please. And you see heart attack, heart failure, stroke, back one slide, please. renal failure, peripheral artery disease, and sudden cardiac death. These are all components of cardiovascular disease. So when you hear the term cardiovascular disease, these are what come to mind. Next slide. And so when we focus in on a heart attack, this is a depiction here to show you that a heart attack occurs when blood flow to a section of the heart muscle becomes blocked, or the heart is deprived of all of the nutrients. And most often, this is the result of coronary artery disease. And you could see here the buildup of plaque. A plaque ruptures or breaks off, preventing blood from reaching to the heart muscle. And over time, in about 20 minutes or so, that heart muscle starts to die and cannot be regenerated, and a heart attack occurs. Next slide. And when we think of the breakdown of cardiovascular disease and looking at the most recent statistics from the American Heart Association, you can see that most of heart disease comes from coronary heart disease. And again, coronary heart disease leading to buildup of plaque in the blood vessels that supply the heart. And when there's a true blockage, heart attacks can occur. We will focus most of our discussion on coronary heart disease, and we'll probably discuss a little bit about stroke as well as high blood pressure. But when you hear the term heart disease, generally speaking, we are referring to coronary heart disease, which accounts for about 49% of all of cardiovascular disease, deaths due to cardiovascular disease. Next slide.
Okay, everyone, we just came to our second poll question, and I'm going to go ahead and read it to you and give you some time to answer it. So the second poll question is, are you currently living with heart disease? The poll is now open. Go ahead and answer that, yes or no. Okay, just about 90% of you have voted, so I'm going to go ahead and close the poll. Thank you all so much. That is going to be the last poll question for the evening. And back over to you, Dr. Mieres.
Thank you, Emily. Let us now focus on the importance of cardiovascular disease to African American women. As you have heard, race and ethnicity can definitely affect your risk for heart disease. And we look at the most recent statistics regarding heart disease in African Americans, and we see that 46% of African American men and 48% of African American women have some form of cardiovascular disease. We know that African American women have a higher burden of stroke, hypertension, congestive heart failure, renal dysfunction, and a lot of it has to do with the high prevalence of hypertension, high blood pressure in the African American community. And as we know, high blood pressure, hypertension is considered the silent killer, because unless you're checking your blood pressure, you're unaware of it. And by the time you know that you have it, you can have end organ damage. So it can just show up in the setting of a stroke, a heart attack, renal failure, and other complications. Next slide, please.
Yep, just hold on 1 second. It's not moving. Oh, there we go.
Okay. Let's take a look at and understanding the high prevalence of high blood pressure in African American women. We know that African Americans are more likely than any other racial or ethnic group to have hypertension. The statistics are startling. 46% of African American women have high blood pressure. African American women develop high blood pressure early in life. And overall, especially in the United States, 2 in 5 African American adults have high blood pressure. Importantly enough, and a note for us all to note, is that less than 50% have the condition under control. And so the important thing is to have the discussion about hypertension with your physician, your nurse practitioner, also to know your family history, because hypertension definitely runs in families, especially in African American families. So understanding and talking about your risk of hypertension, measuring your blood pressure, whether it's going into CVS or whatever your local drugstore can be, to get a blood pressure check, having a discussion with your doctor, and I always say keeping a logbook so you can follow from year to year if your blood pressure is changing or not is really important for all African American women. Speak to your relatives, your mom, your sisters, your siblings, and find out what the family history is of hypertension, of high blood pressure. And so it forces you to have the discussion with your doctor because it runs in families. Next slide, please. And when we also think of hypertension, high blood pressure predisposes to heart disease, predisposes to heart failure, predisposes to renal disease, and importantly, predisposes to stroke. And the same process of atherosclerosis, the buildup of plaque in the arteries that occur in the arteries that supply the heart, can occur in the arteries that supply the brain, leading to a stroke, which is similar to being called a brain attack. And hypertension is one of the biggest culprits because when the blood pressure is elevated and the heart has to pump blood against high pressures, the inside, the lining of the arteries can definitely be damaged, predisposing to a faster and earlier, more aggressive buildup of plaque. So again, blood pressure control is of key importance. You look at the statistics for African American women and stroke. African Americans are more impacted by stroke than any racial groups, and that is directly linked to the high prevalence of hypertension, high blood pressure. African American women and men are twice as likely to die from stroke compared to Caucasian men and women. And the rate of the first stroke in African American women is almost double that of Caucasian women. And strokes tend to occur early in life for African American women than Caucasians. And again, I urge you, linking it to hypertension, high blood pressure, knowing your numbers, knowing your blood pressure, knowing the family history of blood pressure, keeping your own logbook to follow your blood pressure across the decades or each year, being more aggressive in monitoring your blood pressure if you have a strong family history is really important because controlling your blood pressure can certainly help decrease your risk of having a heart attack or having a stroke. Let us now take a look at some of the risk factors for heart disease because as you've heard, one of the first steps in preventing heart disease is definitely knowing, are you at risk, knowing your heart healthy numbers. And so knowing that 80% of heart disease can be prevented, it is really important that all women, and knowing that all women, we are at risk for heart disease across our lifespan, understand our risk factors, know whether we are at risk, and begin to take active steps. Here you see the major risk factors for heart disease, and we can think of the risk factors, the factors that place us or make us more predisposed to having heart disease, as those that are modifiable, meaning we can do something about, so understanding, finding out what those numbers are, and definitely using lifestyle changes, simple lifestyle changes, which we'll talk about, or taking medication to change, to control the risk, to get those numbers into optimal levels. There are risk factors that are non-modifiable. And things like family history, you know, the genetic predisposition, we can't change our parents, we inherit their genes, we inherit the predisposition to medications. It's a non-modifiable risk factor. We know as we age, especially for women, generally speaking, coronary heart disease comes 10 years later compared to men, and it's a disease that definitely progresses with age. So we know, again, all women are at risk across their lifespan, so it's a non-modifiable risk factor because we're all going to age. And heart disease is an equal opportunity killer. Men and women equally prone to developing heart disease. When you look at the modifiable risk factors here, you know that knowing your heart healthy numbers, knowing your blood pressure should be less than 120/80. Having high blood pressure places you at risk for heart disease and stroke. Elevated cholesterol levels, total cholesterol in the 200 range, or an HDL, which is the good cholesterol, less than 50, places us at risk for heart disease. And this is an area, a bit of a controversial area, so we're not going to delve into it, but knowing your cholesterol levels and having a discussion with your doctor to see whether you need medication. If you're not responding to lifestyle changes, is definitely important. Diabetes, a very potent risk factor in women. potent risk factor in all women, and especially in African American women, because diabetic women are 3 to 7 times more likely to develop heart disease, heart attacks, and stroke compared to diabetic men. And of course, cigarette smoking, being exposed to secondhand smoke, very powerful risk factors for heart disease. And being obese, overweight, weight challenged, and physically inactive, again, modifiable risk factor, but women that are overweight or obese and women that lead a sedentary lifestyle, much more prone to having heart disease. As we have expanded into understanding some of the gender-specific aspects of heart disease, there are emerging risk markers. We know that elevated levels of lipoprotein A, which is a type of cholesterol, places women and men at risk for heart disease. And when we speak of the major risk factors for heart disease, men and women share many of the similar risk factors, except we have discovered over the past 5 years or so that pregnancy complications, there are certain risk factors that are unique to women, and pregnancy complications place women at risk for heart disease 5 to 15 years after the pregnancy complication occurred. And so pregnancy complications need to be discussed as a risk for heart disease when you see your OBGYN or your gynecologist or your family practitioner, having a discussion of your pregnancy history is important, because we now know women who develop high blood pressure during pregnancy or diabetes called gestational diabetes or preeclampsia during pregnancy are at risk for heart disease 5 to 15 years later. And this is an important point to include a discussion, especially when we get into our 40s and 50s. We sort of don't think about the pregnancy or pregnancies or any complications. And I think you have to put that on the list to really evaluate your risk for heart disease. Emerging risk factors, a lot of research being done on clotting factors, markers of inflammation, women with rheumatoid arthritis, inflammatory diseases such as lupus, scleroderma, high risk of developing heart disease much earlier in life. And we're now learning that women who are exposed to constant stress, women who are depressed, we're learning more about sleep, are also at risk for heart disease. So ongoing research on the sex-specific aspects of heart disease, and the important point from all of this is that while women and men share many modifiable risk factors for heart disease, that knowing your numbers, that certain risk factors are much more potent in women such as diabetes, high blood pressure, being obese and physically inactive. And then you have certain risk factors that are unique to women, such as pregnancy-related complications. The good news is that when you look at the modifiable risk factors, that something can be done, simple lifestyle changes, changing or making healthy eating choices. And in cases where we need to use medication to control diabetes or blood pressure or cholesterol, definitely we can decrease the number of women, control risk and decrease the number of women dying from heart disease. So as we think about or plan to control, understand our risk for heart disease, focusing on the controllable and modifiable risk factors definitely important. Knowing our blood pressure, knowing our cholesterol levels, avoiding smoking, quitting smoking, avoiding secondhand smoke, making lifestyle changes to control our weight, being active, choosing to move every day, and it's easy. We know that 30 minutes of activity every day is what's prescribed, and that 30 minutes could be dancing, swimming, jogging, doing Pilates, something where you're moving every day. And in today's world, you could easily get a fitness tracker that can help you log 10,000 steps a day. We also know that you can get your exercise in increments of 10 minutes. You don't have to get 30 minutes all at once. Beyond diabetes, controlling, knowing that if you're diabetic, controlling blood sugar with medication or by lifestyle changes, definitely important. And finding ways to control stress. Very powerful risk factors, especially in African American women: stress, diabetes, physical inactivity, obesity, and hypertension. But the good news is knowing the numbers and changing your lifestyle, simple lifestyle changes can definitely control these risk factors. Within the past decade, as we have focused on gender-specific research for heart disease, we have learned, as mentioned, that all women are at risk across their lifespan. And here, from the most recent American Heart Association evidence-based guidelines, is sort of a list and a summary of who's at risk for heart disease. We know that at least 90% of women have at least one major risk factors for cardiovascular disease. And this list here highlights, all the risk factors: cigarette smoking, poor diet, physical inactivity, family history, again important, of premature cardiovascular disease. If you have a father or sibling, male sibling with heart disease less than 55, or a female relative, mother, sister, with heart disease less than 65, definitely, even though you may not have the traditional risk factors, that is a risk factor for you and a risk of developing heart disease. Hypertension, dyslipidemia, abnormal cholesterol levels, so it could be an elevated LDL, which is sort of considered the bad cholesterol, low HDL, which is considered the good cholesterol, evidence of any sort of vascular disease, metabolic syndrome, which is a whole syndrome with elevated blood pressure, abnormal blood glucose, large waist circumference, all coming together and predisposing to heart disease. And additions to this latest publication include poor exercise capacity on a treadmill, so that women with poor functional capacity definitely are at higher risk for developing heart disease compared to women who are active or can actually walk on a treadmill or function on a daily basis. And of course, added to the list are sort of the unique risk factors of pregnancy-related complications, of elevated blood pressure, hypertension during pregnancy, preeclampsia, gestational diabetes, and of course women with inflammatory diseases, lupus and rheumatoid arthritis, being all at risk for having cardiovascular disease, for having heart disease, for having stroke. Let us now spend some time taking a look at strategies to prevent and control heart disease. As mentioned several times, 80% of heart disease can be prevented. Step 1 is to know, are you at risk? Step 2, to factor in the family history. Step 3 is sort of knowing your numbers. And step 4 is coming up with the simple strategies that you can incorporate into everyday life to really decrease your risk of having heart disease and stroke. So what can we do to prevent and control heart disease? As mentioned, the good news, you can lower your heart disease risk. Small steps, small lifestyle changes will lead to big gains. Knowing your heart healthy numbers, managing your blood pressure, managing your blood sugar, cholesterol, and definitely controlling weight by changing your eating habits and choosing to move every single day. If medication is needed, having a discussion with your physician, your nurse practitioner, to figure out, to find the right medication to control your blood pressure, and if needed, to control blood sugar as well as to lower your cholesterol. And importantly, choosing to be active every day. And if for by any chance, hopefully not, you recognize the signs of a heart attack in yourself or in a family member, but importantly in yourself, do not drive to the emergency room, do not ignore it, and call 911. So sort of a quick one-pager of the start of understanding and controlling your risk for heart disease. Importantly, we should all recognize the signs of a heart attack, knowing that across our lifespan, all women are at risk. Recognizing the signs of a heart attack is of vital importance. Generally speaking, if you look on the left-hand column, here are the signs that are typical in both men and women. The classic description of pain, pressure, squeezing or stabbing in the chest, and definitely common in both men and women. Women after menopause tend to have these symptoms, and these are very similar to the symptoms seen in men. Pain radiating to the neck, pounding, heart rate, change in rhythm, shortness of breath following the squeezing or accompanying the pain or pressure in the chest. Sometimes showing up just as heartburn or an uncomfortable feeling in the middle of the chest, leading to nausea, vomiting, abdominal pain, followed by colds, sweats, or clammy skin that can also be accompanied by dizziness. As we have studied the gender-specific aspects and differences of heart disease, we have seen that often women can show up with less classic symptoms in the setting of a full-blown heart attack. And women can be seen presenting with their heart attack with milder symptoms without chest pain. So be on the lookout, and it's important for women, if you know you're at risk for heart disease, a family history, some risk factors, and you're seeing symptoms that are unusual, such as sudden, for your normal life, sudden onset of weakness, shortness of breath, fatigue. It can also show up as back pain as the first presenting sign. You can have that chest discomfort, neck pain, jaw pain without the accompanying chest pain. And so the key thing is that there's a broad spectrum of symptoms that show up as a heart attack in women, and all women need to be aware to recognize the signs of a heart attack. And it first begins with sort of understanding your risk, knowing the signs, and then in the setting of any of these unusual symptoms or symptoms that are unusual for you, definitely calling 911. So what are our heart healthy numbers? What are our heart health goals? And this is just a quick summary here of what we need to do on a daily basis, what we need to incorporate in our daily lives to decrease our chances of having a heart attack or having a stroke. No tobacco or secondhand smoke. The LDL cholesterol, so this is knowing your numbers, should be less than 100. HDL cholesterol for women greater than 50. Triglycerides should be less than 50. And an optimal blood pressure is one that's less than 120/80. Fasting blood sugar is less than 100. And weight control, the body mass index, which is commonly used, should be less than 25. But I personally, when you think of weight and height, I like a waist circumference less than 35 inches for women, less than 40 inches for men. And I think you could sort of think about it as if your waist circumference should be at least less than half your height in inches. Because we know that women and men who store fat in the middle region definitely are predisposed to insulin resistance, leading to diabetes, leading ultimately to heart disease and placing us at risk for cardiovascular disease. Another important heart healthy goal is trying to get 30 minutes of physical activity at least 5 days a week. And as mentioned before, physical activity means moving in some way, so swimming, walking, jogging, dancing, bicycling, doing some activity, choosing to move for 30 minutes every day. And you can get your 30 minutes in increments, in 10-minute increments. And in today's world where there are lots of fitness trackers, getting a tracker, making a pledge to do at least 10,000 steps a day, you could start, which is about 4 to 5 miles, and you could, just by walking, or you can, if you have been sedentary, making a pledge to start with 5,000 steps a day definitely will get you on the road to heart healthy living and choosing to move every day. And I always like to add 10 minutes of laughter every day, because laughter to me, as well as exercise, is a good stress reduction. And we know that women who are prone to chronic stress are at increased risk for having heart disease. So 10 minutes of laughter, whether it's your favorite movie, if you're watching a movie, jogging in place, walking in place, not sitting on the couch all the time, getting up ever so often to jog, to walk around is definitely important as well. So where are we as we take a snapshot or a state of the union in terms of, in 2005, in terms of women's heart health? We've had many national efforts over the past decade and a half which definitely have made a difference. We have seen, as mentioned, over a 25% decrease in the number of women dying from heart disease, cardiovascular disease over the past decade. Yet, all is not, we still have a lot of work to do, as still more women than men since 1984 have died from all cardiovascular diseases. and still, even though we're making progress, we still have a lot of work to do. Here's a quick snapshot of the national efforts. WomenHeart, who's hosting this program today, and I'm proud to be a scientific advisory member and proud to have been involved with WomenHeart from the get-go, is the first and still only national organization solely devoted to women's heart health and providing patient support. This year, we're celebrating 16 years of advancing women's heart health. The Heart Truth campaign, which started the entire sort of efforts, almost started at about the same time as WomenHeart, and they've been in collaboration, federally funded campaign with the purpose of educating and raising awareness about heart disease as the leading cause of death in women. We have the Society for Women's Health Research, promoting the advancement of gender-specific research to improve women's heart health. And then we have the American Heart Association's Go Red for Women campaign, a movement which started in 2004 with the purpose of raising funds for research, raising awareness, and developing evidence-based guidelines for the medical community so that we can better understand and apply evidence-based strategies to improve women's heart health. We take a look at the impact of national efforts, where we are in 2015, and we see the impact of the Heart Truth. This is the federally funded Red Dress campaign. Nearly 70% of women know that heart disease is their leading health threat, compared with just 12 years ago, and polls from the NHLBI. We look at the impact of women heart support networks, enhanced quality of life by 93%, improved treatment compliance and adherence for 85% of the members, improve the ability to communicate and empowered to communicate with healthcare providers, with the medical community, an increase by about 85%, increased understanding of heart disease stated by 93% of our members, and improved ability to communicate and explain the condition to family members, co-workers, and friends, 86% improvement. So definitely WomenHeart, we're spreading the message, we're empowering women to be in charge and to lead change and improve their heart health. You look at the impact of the American Heart Association's Go Red for Women campaign, women who joined the Go Red for Women movement, about 2/3, over 6 in 10, modified their diet to eat more healthy foods. More than 50% of women exercise more frequently, and more than half have checked their cholesterol and blood pressures and know these two important heart healthy numbers. And more than 1/3 have talked to their doctor about their risk for heart disease. So significant progress is being made. Women are becoming empowered, they're becoming knowledgeable, but a lot more work has to be done, because as we saw, disparities, especially among African American women not being aware, Latino women not being aware, we still have a lot more work to do. So as we look at lessons from the past decade, the past 2 decades, since we started the focus research and the focus approach to looking at the gender and the sex-specific differences in cardiovascular disease, we know that there are indeed gender differences in the presentation, manifestation, and diagnosis of heart disease. We know that there are gender differences in mortality, that 38% of women versus 25% of men will die within 1 year after a heart attack. And we have to change the statistics. Early recognition, women recognizing that they're having a heart attack, calling 911 and getting to the emergency room in time can definitely help decrease the number of women dying from a heart attack and the number of women dying within 1 year after a heart attack. So the focus is on early recognition of symptoms, accurate diagnosis, proper treatment, if we are to reduce the number of women dying from heart disease. Let us now take a quick look at some of the strategies that I was fortunate enough to co-author with Dr. Terry Parnell in the book HeartSmart for Black Women and Latinas. This was a book that we co-authored in 2008. It is currently out of print. We're hoping to update it in the near future or work with some other members of the WomenHeart team to come out with a replacement or an update to HeartSmart for Black women and Latinas. And our idea of doing this book was based on women telling us that yes, they understand the awareness, yes, they understand, they're at risk for heart disease, but wanted sort of a tangible roadmap or workbook that they can refer to begin their sort of heart healthy living journey. And so this book was conceived, and we sort of did it in a 5-week plan because we figured 5 weeks you get started, you become hooked, and we called it sort of the HeartSmart Approach to heart healthy living, with a focus on making small changes to make a big difference. So at the start of the journey, it's sort of 3 steps to the passport to heart health. In week 1, you take stock and you get ready. And this is like taking inventory. Week 2, you get moving, and we recommend starting with 10 minutes a day. Week 3, just figuring out ways to make heart healthy choices when it comes to food. Week 4, devoting some time to come up with stress reduction strategies. And week 5 is putting it all together and finding a friend or family member to join on the heart healthy journey. So let's spend a few minutes quickly taking a look at some examples of weeks 1 to 5. So in any sort of new journey, any sort of new plan, especially when it comes to food and getting ready to start a heart healthy fitness plan, we felt it's time to take a look, take stock, get ready, look at the refrigerator, get rid of all of the tempting foods that we know can be deleterious to heart health. Not the types of foods that taste good, but definitely can add inches to the waist, and once the inches are on, difficult to get off. So really taking a look at the pantry, purging the refrigerator, getting rid of the unhealthy foods, and restocking with healthy choices, and getting a pair of comfortable walking shoes. Week 2, we figure this is the week you start focus on getting moving, trying to incorporate at least 10 minutes of some activity into your daily regimen. And a quote from Thomas Jefferson, walking is the best possible exercise. Figure out a way, habituate yourself to walk very far. We know the benefits of moving. Ultimate goal, as the American Heart Association outlined, at least 30 minutes most days of the week. Walking can help you get into that optimal heart healthy region on heart healthy numbers. It helps control your blood pressure, helps control your blood cholesterol, helps with blood sugar, definitely in weight management, and builds stronger bones, and definitely is a good stress reduction agent and reduces anxiety and depression. And people that exercise or choose to move every day, again, I said dancing, swimming, jogging, Pilates, dancing, whatever it is, have increased energy levels. Week 3 is the week that you focus on changing the diet, changing your eating habits to include more heart healthy substitutions, more heart healthy foods. So as you move on to week 3, you're combining week 2 with week 3, so you're moving, choosing to move at least 10 minutes a day with the goal of getting up to 30 minutes. So week 3 might be a time, if you're starting at 10 minutes, adding to getting up to 20 minutes a day. For those who are big exercisers, you just keep on adding more minutes, 30 minutes or more, definitely beneficial. And week 3, you focus on increasing fruits and vegetables, making that plate much more colorful, incorporating 2 servings of fatty fish into your diet, into your eating your meals every day, getting rid of frying and grilling and broiling. And I always think that breakfast is the most important meal of the day. Starting with some sort of protein and some vegetable, definitely important. Limiting salt, putting down the salt shaker, not adding sugar if you can avoid it is really important. Downsizing your dinner, if you go out to eat, taking half of it, bringing the other half of it home, and really paying attention to your food choices. It's definitely important this week. So by week 3, you've added 10 minutes of activity. You should be up to 20, and now you're making your plate much more colorful, putting down the salt shaker and not adding additional sugars. You get to week 4, and in addition now you should be up to 30 minutes of some activity every day. You have made the plate more colorful, including breakfast or some small breakfast to start the day. And week 4, you add stress. You add stress reduction strategies and simple things for controlling stress, because stress is all around us. Making a to-do list, and figuring out how to delegate so that you're not all overwhelmed. Having a positive attitude, sort of worrying about the things, sort of realizing that you cannot change every situation, sort of just worrying about the things that you can change, but more importantly, finding 10 minutes to listen to your favorite music, doing a morning walk, figuring out ways to relax. If you're at work, doing some simple meditation or deep breathing exercises, especially in stressful situations, making sure you get enough sleep, and finding time to laugh and enjoy your family and friends. And as we get to week 5, the secret to sort of conquering heart disease, the HeartSmart approach, it's putting it all together. We came up with the mnemonic feast, getting family and friends to join you, because there's strength in numbers, as you saw from the WomenHeart support group, from the AHA Go Red for Women group, that when women are together and when we have support, we're definitely much more likely to sustain or different changes. So whether it's exercising on a daily basis, whether it's making the plate more colorful, there's definitely strength in numbers. So getting family and friends to join you on your heart healthy journey, eating that colorful plate, heart healthy, making heart healthy choices. You can still enjoy your traditional recipes, but definitely making substitutions that are heart healthy, choosing to be active every day, reducing stress, and ultimately taking control of your health, making an appointment, partnering with your doctor for heart or your nurse practitioner for heart healthy living are sort of the 5-week approach to getting started on your heart healthy journey and reducing your chances of getting heart disease, dying from heart disease, controlling your risk factors for heart disease and stroke. And so I would like to end by saying, 5 things to remember, 5 small steps, get moving, aim for 30 minutes a day. Remember, there's benefit to getting 10-minute intervals, so you don't have to necessarily join a gym. You need a good pair of walking shoes. And if you want to get a fitness tracker so that you can actually log your steps, I think that's an important thing to do. HeartSmart food choices, 5 servings, fruits and vegetables, 2 servings of oily fish per week. So salmon, you can grill it, you can boil it, recognizing the importance of portion control. So if you go out to a restaurant and you get a huge plate, asking your waiter or waitress to put half of it so that you could take home for a meal the next day, and only eating half would definitely help with portion control. Learning to cope with stress, 10 minutes of meditation, relaxation, music, yoga, laughter every day. Remember, if you're using stress reduction, if you're going to watch your favorite movie, something that's comedy, get up every so often, every 20 minutes or so, walk around and jog in place or walk in place while watching the movie. Getting family and friends to join you on this journey, definitely important. And fostering a partnership with your doctor, with your nurse practitioner, your health coach for heart healthy living, definitely important, and important for sustaining a heart healthy numbers. With that, I thank you so very much for your attention, for spending time with us, for taking time to learn about an update in heart disease, heart health for African American women. Progress is definitely being made, but we need to spread the word that all women are at risk for heart disease, that African American women much more prone to heart disease. We need to increase awareness so that the next time statistics are done, we see that at least 90% or more of African American women recognize they are at risk for heart disease and know that you can take small, simple steps to control your risk factors and decrease the chances of dying from heart disease.
Okay.
Ladies and gentlemen, I thank you for your attention.
That was so great, Dr. Mieres. Thank you so much. And I also just wanted to mention that here at the national office at WomenHeart, we've been doing a pedometer challenge for American Heart Month, encouraging everyone to get their 10,000 steps a day and to get moving. So you're just solidifying the fact that, you know, being heart healthy, and I'm glad to hear you say those things. So everybody, we're going to go ahead and start with the Q&A portion of the webinar. You type your question into the question box on your control panel and you click submit. Your question is going to appear on my desktop, and I will read each question aloud so Dr. Mieres can answer the question. I will read the questions in order in which I receive them. So you guys can go ahead and start submitting your questions. Thank you, Dr. Mieres. That was so great.
Thank you. A pleasure to be here.
Okay, let's just give it a couple minutes. Okay, so our first question comes from Catherine, and she says, how much does sleep matter in heart health?
Good question, Catherine. And so there is some new research, relatively new research coming out that getting a good night's sleep is definitely important, especially for decreasing the risk of heart disease. And so the recommendations is about 6 to 7 hours. Women who sleep for 6 to 7 hours every night have a decreased risk of heart disease. And what happens is when you do not get enough sleep, levels of cortisol are elevated, and cortisol is sort of the fight or flight mechanism, and you're much more predisposed to having an elevated blood pressure, elevated blood pressure, abnormal cholesterol profile. All of the risk factors can become enhanced in the setting of lack of sleep. So more research is needed to really understand it, because there is, in that same article, women who got sort of greater than 8 to 9 hours of sleep, there was a higher, sort of a reversal of the benefits of sleep. So it's an area of research, but the general thinking is that somewhere around 7 hours is sort of the magic number of hours of sleep needed to decrease your risk for heart disease.
Okay, great. Thank you. We just have a general comment from Sharon. She just wanted to thank you for presenting today and tell you how relevant this information was. She lives in an 80% Hispanic community, and she can take this information, and it will be very helpful to her.
Wonderful. Thank you.
And then Caroline asked, why do you think African American women's statistics are so much worse than white women?
Well, I think, a good question, Caroline. I think that when you look at the risk factors for heart disease and the high prevalence, for one, of high blood pressure in the African American community, that alone can account for, predisposing to heart disease, especially because high blood pressure is sort of silent. We call it the silent killer, because unless you're checking your blood pressure on a regular basis, you have no idea that it's going to be elevated. And by the time you show up with symptoms, a lot of damage has been done and it's irreversible. So definitely the high prevalence of hypertension definitely places African American women at higher risk. In addition, the high prevalence of being obese or overweight in the African American community, again, adds to that risk. And that could be explained by maybe food choices, as well as inactivity, not being active every day. So you have risk factors that predispose to heart disease. So the high blood pressure, being overweight, being inactive, and you have those three risk factors together, higher prevalence of heart disease, also higher the being overweight and being inactive, also predisposing to another powerful risk factor, diabetes, because women that are overweight, especially if most of the weight is stored in the central region, belly fat, are definitely more predisposed to developing diabetes than women who do not have a large waist circumference. So compounding factors definitely place African American at higher risk for heart disease. The important thing to know is that by choosing to move every day, enjoying the traditional menus, but making heart-healthy substitutions, putting down the salt shaker, not adding sugars, and definitely trying to control weight can cut that risk of heart disease significantly.
Great, thank you. Could you please repeat the acronym for FEAST?
Oh, it is, FEAST refers to friends and family, getting a partner to join you in your heart-healthy journey. E refers to making heart-healthy choices. So it's really making, every time you sit down to have a meal or to eat, you're making it a colorful plate, avoiding fatty foods and fried foods, and really the colorful plate means that there are always fruits and vegetables there. Activity is the A, choosing to move every day, choosing to get at least 30 minutes of some activity every single day. S is stress reduction, finding time to laugh, finding time to do yoga, finding time to do some sort of meditation or even simple breathing exercises when faced with stress. And you could add to that, making sure you get enough sleep. And then T is taking control of your health. And by that we mean having discussions with your family physicians, your nurse practitioner, and knowing your numbers definitely puts you on the road to understanding your risk and taking control of your heart health. So family and friends, eat heart healthy, activity, stress reduction, and taking control of your heart health.
Okay, great. So we had two questions that were kind of similar. They're kind of asking what is being done to educate the medical community on taking these women's heart issues seriously, and if they're not, are these doctors adding to the disparities among the African American and Hispanic community for women?
So again, great question, and this is where I think the American Heart Association's Go Red for Women campaign is sort of, honing in on coming up with the science and publishing the science for the medical community to understand all of the gender-specific differences. So you have guidelines being issued for the medical community, spreading the word that there are indeed gender differences, and guidelines highlighting the fact that certain ethnicities, especially African American women, Latino women, are at highest risk for heart disease. Importantly, the guidelines highlight the differences in symptoms so that when women show up in the emergency room, having sort of not the classic chest pain symptoms that men have, they are not sort of put aside, but they are taken seriously. I would say we have come a long way in educating the medical community. We still have a lot of work to do. And I think that when you look at what WomenHeart is doing, WomenHeart is giving women the power and giving the women the knowledge that if you think you're having a heart attack or if you have heart disease, you can be an advocate for your own self and initiate the discussion. I think it all comes down to sort of us as women knowing our risks, taking charge, and really sort of demanding that we be treated as partners in our health. And so more work needs to be done to educate the African American community, and I know we're working on sort of getting champions in the African American community to talk, to share stories, women who have had heart disease, women to become ambassadors in the African American community, to share the simple steps, to talk about heart disease and share the simple life-saving strategies. with fellow women. And we are working hard to educate the medical community at all levels, not just doctors, nurses, technologists, the EMT workers as well, about the gender differences and the high prevalence of heart disease and risk factors in the African American community. So great question. More work needs to be done.
Great. Okay, so just 2 questions left. Can you please speak about the relationship between heart disease and stroke?
Yes. So heart disease and stroke are all, generally speaking, caused by the same process of atherosclerosis. And atherosclerosis is the buildup of fatty substances or plaque in the arteries throughout the body. So in the arteries that supply the heart, we know that the risk factors that predispose to that sort of damage of the lining of the heart muscle make the vessels that supply the heart, making heart plaque much likely to build up. Similarly, the same process that can lead to a heart attack can occur in the brain. Same risk factors, especially in African American women, hypertension being a big culprit. The same process of atherosclerosis can occur in the vessels that supply the brain, leading to a stroke, which is, we like to think of it in simple terms as a brain attack. So the same process of atherosclerosis predisposes to heart attack, or is responsible for a heart attack, and the same responsible for most strokes.
Okay, great. And then last question. So there's increasing awareness about the high-risk communities of African American and Latino women. What are the risk factors for South Asian men and women, if they're different, if they're the same, or, you know, can you speak a little bit on that?
Yes, so good question. Similar risk factors for African American women and Latino women. In African American women, it's the high prevalence of hypertension, high prevalence of obesity, high prevalence of inactivity as predisposing factors. In the Latino women community, there is a high prevalence of diabetes, as well as a high prevalence of inactivity and obesity predisposing to heart disease. In the South Asian women community and men community, there is prevalence, and there's more research being done about this, of an abnormal cholesterol profile that predisposes to high risk for heart disease. And that abnormal cholesterol levels has to do, especially, you know, just so we can't go into all the details, but one is having a low HDL, and HDL is the high density lipoprotein, being much lower than it should be, as being a very powerful sort of undetected risk for heart disease, as well as levels of lipoprotein little a, another sort of component that predisposes. As well as in the South Asian community, high incidence of sort of diabetes and or the metabolic syndrome. And again, I think it depends on which part of South Asia you're from. But I think, generally speaking, the culprits are abnormal cholesterol profiles, abnormal cholesterol levels being, especially HDL being much lower than it should, as well as a higher prevalence of diabetes.
Okay, great. So that is going to conclude our webinar for this evening. Dr. Mieres, I want to thank you so much.
Thank you very much.
And I just want to let everybody know you will receive a follow-up email from GoToWebinar on Monday or Tuesday around this time, 7 p.m. Eastern, East Coast time, with a link to the webinar recording on WomenHeart TV. It's our YouTube channel, so you can watch it again if you'd like. Also, you're going to receive the link to the post-webinar survey so we can see what you learned from this webinar. Thank you again so much. Dr. Mieres, do you have any parting words tonight?
You know, I thank WomenHeart, thank Emily, Lisa, and the entire WomenHeart group for establishing this webinar. And I want to thank all of the attendees for attending. Please become a WomenHeart member. Spread the word. Heart disease, 80% of heart disease can be prevented. Simple, small lifestyle changes can definitely put everyone, all women, on the road to heart healthy living. So thank you very much.
Okay, thank you. That's a great message, Dr. Mieres. Everyone, you guys have a great night.
Bye-bye.
Bye.